Okay, so this is the specimen collection video. Prior to any collection, I would identify the patient, I'd introduce myself, I'd don gloves, and I'd ask the patient about any allergies. So the first sample we're going to collect is a stool, an occult stool sample. And with this, the stool has already been collected. I'm going to use a tongue blade, and again, I have gloves on. I'm going to use a tongue blade, and I'm going to take a sample of a stool with my tongue blade, and I'm going to, this is my reagent card. I'm going to smear the sample onto panel 1, and then I'm going to take a different tongue blade, and I'm going to take from a different area of the stool sample, and then I'm going to smear that onto my panel 2. I'm going to discard of this in biohazardous waste. I'm going to turn the card over, and I'm going to use a specified amount of drops. I'm going to place those drops on each panel, and then I'm going to wait about 30 to 60 seconds for the results to show. I'm going to then place the card in a lab collection bag, label it, and send it off to the lab. I would then, if I were to take a gastric secretion to test the pH, I would use the aspirate that I would most likely collect from the feeding tube before feeding. The aspirate would be in a container like so. I would then take a, let's see, all right, I don't have all of my supplies here. All right, I could use a tongue blade as well. I would use a clean tongue blade. I would dip the tongue blade into the collection container. I would place that on a reagent card, smear that on there. And there are 2 places that I would put the sample. I'd put one part of the collection on the pH, in the area of pH, and then I'd put another on the occult blood area. I would use a reagent and a specified number of drops. I would place that onto the occult blood side, and then I would read that card within 30 to 60 seconds. I would then put that card in a lab specimen container, label it, and send it to the lab. All right, so for my urine specimen, this is a clean catch bottle of urine. In order to test the pH on it, I would simply use the dipstick that comes along with that. I dip the stick all the way in that urine sample, and then I'd give it maybe 30 seconds to show the result, and then I would simply place it along the bottle and match the colors with the corresponding pH. And I would do the same for the gastric secretion or the aspirate. And I would then dispose of the dipstick, or actually I'd put that dipstick and the urine sample in a lab collection bag, label it, and send it to the lab. And this is the first part of collection, specimen collection. Afterwards, I would document